one of the biggest areas of confusion about knee replacement is how long it takes to recover from surgery. Most patients underestimate this. A knee replacement is not an operation you'll jump out of bed the next day from and feel like you are cured. Whilst every patient will recover at different speeds, in general, I would give the following advice. Full recovery from a knee replacement may be up to 18 months after surgery. Some patients will take this to mean that it will be 18 months before they can do anything, but I don't mean that at all. I mean that this is how long it could take for your knee to be as good as it will ever be. In other words, there can be some ongoing improvement in your knee function even up to 18 months after surgery. In the first 2 weeks after surgery, most patients will be in more pain than they were prior to surgery. Your pain will be manageable with the medication and other supports we provide to you. It's our job to control your pain so that you can begin to mobilise and get your knee moving. However, it's still a pretty challenging period for most patients, and you can expect your knee to be quite swollen during this time. Most patients will require the use of a frame for the first few days after surgery, and then a walking stick for several weeks after. It's not a race to get rid of your walking stick or frame. It takes different amounts of time for every patient, depending on their age and also how bad their knee pathology was to begin with. You will also require some simple, regular medication, such as Panadol and anti-inflammatories, for a minimum of 2 to 4 weeks, and possibly longer. If you still have pain despite these simple medications, you'll have a supply of stronger pain medication to take if and when required. We call this breakthrough pain relief. If your pain breaks through the regular medication, you have a safety net of stronger pain relief ready to go. Driving a car can usually occur from 4 weeks. Most occupations would require 4 weeks off work completely, but a return to light or office duties could occur from 4 to 6 weeks. I would strongly encourage a transition period of working from home if possible. Your knee will be swollen and sore if you spend long periods of time walking around and on your feet. Returning to manual duties would be a minimum of 6 to 8 weeks after surgery, and possibly longer depending on your occupation. By 6 to 12 weeks, the majority of patients will be 50% recovered and beginning to feel that their knee is better than it was prior to surgery. Some patients experience this much sooner, but in general, 3 months is a realistic guide. By 6 months, the majority of patients will be 70 or 80% recovered and back into all usual activities. Most patients are not taking any pain medications during this time. Now, the final 20% of your recovery occurs slowly, but gradually from 6 months after surgery, right up until the 18-month mark that I previously mentioned. I tell my patients that during this period they'll become more accustomed to their new knee joint and the little niggles slowly fade away. During this period of time, your body is still very much healing and recovering from the surgery. Now, swelling is a really important thing to talk about, and many patients are concerned about it. But the reality is your knee can remain swollen to some degree for 6 or more months after surgery, and this is completely normal. It is a sign that your body is sending more blood and more nutrients to your knee to continue the healing process. The bony implants are fully healed into your knee within 6 weeks, but your body will continue to heal the soft tissues around the knee for 18 months or more after surgery. As long as there is some healing process continuing, there will also be some swelling. Many patients are surprised by this, but it is completely normal. You should notice a gradual reduction in the amount of your swelling over time. Now, I'll do everything I possibly can to give you the best result, but sadly, I can't make you or everything around your knee any younger. Your knee will also feel hot for several weeks, and a lot of patients comment about this. This is again normal, and due to the increased metabolic activity as your body continues its healing response to surgery. Don't forget, even though your surgeon has used skill and care to replace your knee, it's no surprise that things take a while to settle. Patients will describe a feeling of numbness, especially over the scar and the skin on the outside of their knee and leg. This is because very fine nerves, about the size of a human hair, are cut through when the skin incision is made. Now, there may be some improvement in this over time, but it will take 6 months or longer for that to occur, and there can be some permanent numbness. Taking 500 milligrams of vitamin C twice a day for 3 months may assist in helping this to settle down. Patients can also report a different range of symptoms within their knee joint. Some say that their knee doesn't feel quite normal, that there is clicking and catching, or sometimes even a feeling of clunking. Now this is almost always normal and largely due to scar tissue and having a quite hard and artificial implant inside your knee, in comparison to your native knee that was quite soft and more natural feeling. Some of the clunking may be due to the hard metal and plastic of the prosthesis knocking together, occasionally like this. I would not recommend that a patient runs after having a knee replacement, but you can walk, swim, hike, ride a bike, go to the gym, and pretty much build back into most of the activities you enjoy. For example, playing golf and a casual hit of social tennis is probably fine for most patients. Most patients find it uncomfortable to kneel on their replaced knee, and in general that should be avoided. If you would like to talk to me about your knee, then please call my rooms at any time. If you haven't already had appropriate scans, I can easily arrange for these to occur before your appointment.